Okay, good afternoon, viewers. So here is another episode of Do You Know, courtesy of Mr. Friday
Thank you.
Agada
Thank you.
and Imaging Technology. So we'll be doing some little interview with him without wasting much of our time. So we'll commence immediately.
Thank you. Go ahead.
So now, a woman with excruciating pains and stony belly with darkish blood discharge walked into your diagnostic center. So what should be the first diagnosis in your mind as an imaging technologist?
Yes, that should be placenta abruptio.
And then as an imaging technologist, a pregnant woman who is due and was sent to you for perimetry examination, what are the anatomical structures you should see on the X-ray radiograph before passing it to radiologists?
Yes, I should be able to see sacral promontory, the coccyx, the head of the femur, and the baby's presentation on the radiograph.
All right, and then what are the anatomical landmarks to visualize pancreas on ultrasound scan?
Yes, you should be able to see abdominal aorta. You should be able to see superior mesenteric artery, that is SMA. You should also be able to see the spine shadow. These are the most of the landmarks. Even the splenic vein also are there to create an acoustic window for you to visualize pancreas.
So a baby below 3 years, with history of stolen blood, with mixed mucus and distended abdomen. So what should be your first thought of diagnosis when the baby is brought to you?
Yeah, that should be intussusception. Intussusception will first come into my mind.
Okay.
Intussusception.
Okay. So what are the 3 stages of labor? What was it now? Can you mention them?
Yes, we have dilation of the cervix, the delivery of the baby, and then expulsion of placenta.
And then quickly, upon an X-ray examination of hip joints. Now, one of these hip joints appeared diminished with excruciating pains on it. So as an imaging technologist, what could be or what could have been the pathological finding?
That should be a vascular necrosis of the hip joints.
Okay, so a large cyst mass, either with septation found at the superior aspects of the uterine fundus, invading into umbilical region. What pathological finding could that be?
That should be cystic adenoma. Cystic adenoma.
Now, can you tell us the 3 glands, that is thyroid glands? Can you tell us how many they are? Like the anatomical part of it. Can you tell us?
Yes, we have right lobe, the left lobe, and the isthmus. So the isthmus connects the left and the right lobes of the thyroid glands.
All right. People often talk about fibroid, and some operations that we don't even know what it means. So I just quickly want you to tell us, what is that medical term called? That is the operation, the surgical operation. What is it called for fibroid?
Okay, the medical term for fibroid removal is called myomectomy.
Okay, and then also the medical term for the removal of womb and ovaries. What is it called?
It's called total hysterectomy.
So also the medical term for chest pain. What is it called?
It's called angina pectoris.
Now, the best medical procedure for or to diagnose perforated ulcer is known as what?
That should be done through abdominal X-ray. Abdominal X-ray.
Okay. Do you have anything to say further?
No, not much. I think with what you have, interviewed me with, it will help some medical students out there, and for those that are also practicing, even myself, it will make my brain to be at alert.
All right. So, how many protective layers that cover the spinal cord? And what are their names? How many are their names?
We have dura mater, arachnoid mater, and the pia mater. So they combine to form meninges, and the inflammation of the meninges is called meningitis.
So what was that infection caused by very fine ash and sand dust? What is the medical term?
That thing I've been trying to dodge, I know it, but I don't know if I'll be able to pronounce it very well, sir. So let me try.
You are in the field, you should do it.
It is called pneumono ultramicroscopic silicovehiculosis.
Wow.
Yeah.
That's a long one. So a medical term for enlargement of the heart is called what?
That is cardiomegaly.
Cardiomegaly.
Yes,
So,
sir.
and then lastly, the medical term for impacted stones in gall bladder is
Yes.
called what?
That is called cholelithiasis.
Cholelithiasis.
Yes, sir.
So thank you, and then viewers, I really hope you enjoyed this episode. We stay tuned for another episode of Do You Know, courtesy once more of Mr. Friday Agada and Imaging Technologies.
Thank you, sir.
Thank you very much.
Thank you. You're welcome.
We'll see you on the next episode.
Thank you, sir.